TCU, or Transitional Care Unit, is also known as our swing bed unit. It is a transition from hospital or acute care to home. These patients are admitted for a short period of time to gain the strengths and the knowledge they need to return home.
Most people come directly to our transitional care unit when they're discharged from the hospital. The average length of stay is 10 to 14 days for most people. If you get better faster, sometimes we are able to discharge patients earlier, and some more complicated cases sometimes stay longer.
Sometimes during their stay, it's determined that home is not the best plan, or that they may need additional services at home. So we can provide resources for home health or hospice services depending on how the patient is moving through their care plan. TCU is different than hospice care. Hospice is a service that can be provided in the transitional care unit. However, there are different levels of hospice. There's general inpatient, where the patient has acute symptoms that need managed, and that can be done either in a facility like the hospital or an acute care facility.
All patients are seen by the providers at least on admission and discharge. Doctors are accessible 24 hours a day for any patient needs during their stay. Patients will also be seen by dietary, physical therapy, occupational therapy, and nursing pretty much on a daily basis.
Our transitional care unit has a wide range of services. This includes physical therapy, occupational therapy. We have in-house lab and in-house radiology. This provides an additional level of care that's not received at most other transitional care units. We encourage family to be involved in their care and will often bring them in for different services and education.
People often wonder when transitional care unit is appropriate. Anytime a patient has had an extended hospital stay and is not able to return home immediately, then TCU is appropriate. We serve a wide range of patients. Acute patients who have had an illness that has required an extensive hospital stay, maybe someone that's had a stroke recently, or if they've had a surgery. Some patients require extended IV antibiotics, and we are able to provide that care. Wound care is also another specialty that we have.
Our TCU is physically located in a hospital. This allows our patients to have access to all the testing and treatments that a hospital has. Our nursing to patient ratio is very low, ensuring that you have a nurse at your bedside when you need one.
Most insurance companies cover skilled care. That is what the transitional care unit is. Depending on the insurance, there are different amounts that would be owed for co-pays, deductibles, out-of-pocket, and different facilities are participating with certain insurance companies. At Hocking Valley Community Hospital, we accept traditional Medicare, some commercial plans, and most managed Medicare plans. We do not accept Medicaid or managed Medicaid plans as a primary payer. If they have that as a secondary payer, then that helps pick up on the copays. Medicare covers for transitional care unit stays. It covers the first 20 days at 100%, and then the remaining 80 days at 80%, and the patient would have a 20% copay, or if they have a secondary insurance, then that picks up on the 20% copay. Just because Medicare covers up to 100 days per episode of care does not mean that the patient can stay here that long. It's based on the interdisciplinary needs and the skilled therapy and skilled nursing services that are required, and the criteria must be met. If a patient has a managed Medicare plan like Humana, Aetna, Anthem, then the length of stay is also determined by the insurance company. The case manager submits reviews, and the insurance company decides if they are allowed to continue their stay. Commercial insurance plans are similar to the managed Medicare plans. The case manager has to submit reviews, and then the determination is made by the insurance company if they will continue the approval. If you have questions about the transitional care unit and if you may be appropriate for our care, you can call 740-380-8315.